Emphysema is an incurable airway disease of the lungs. It is due to the destruction of the alveoli, the alveolar walls, and a loss of elasticity.
One day, Bill Robertson went to the doctor's office to ask about his shortness of breath during physical activity. After a short health history questionnaire, the doctor concluded that Bill is a 50-year-old male that has been an avid smoker for 15 years. After some testing, the doctor concluded that Bill has emphysema.
The doctor explained to Bill that emphysema is mainly caused by smoking. However, alpha-1 antitrypsin deficiency can be inherited. Other factors include marijuana, tobacco, and exposure to secondhand smoke. Fumes, dust, and exposure to indoor and outdoor pollution are also risk factors. An individual begins to experience symptoms between the ages 40 to 60.
In the normal pathophysiology of the lungs, the bronchi branch into bronchioles. Small pouches called alveoli are found at the end of the bronchioles. Alveoli play a very important role as they are the primary site of gas exchange between the air and the blood. In normal alveoli, there is a protein called elastin which allows for recoil and pushes the carbon dioxide out of the lungs. An individual normally breathes by the exchange of carbon dioxide and oxygen between the blood and the alveoli through the process of simple diffusion. An individual inhales oxygen through the mouth and it is passed through the trachea into the lungs, which separate into bronchi, which branch into bronchioles, and then into the alveoli. Proper lung function involves an elastic aspect of the lungs. When the oxygen reaches the alveoli, it then diffuses the oxygen into the blood with the requirement of a concentration gradient.
When an individual has emphysema, there is a loss of alveolar tissue and elasticity. The loss of alveoli leads to the reduction of the surface area for gas exchange to occur. A breakdown of elastic tissue and collagen also occurs, causing the bronchioles to collapse, which results in CO2 to be trapped in the alveoli. The air trapped causes the alveoli to become flattened sacs, which causes respiratory acidosis. This is when there is too much CO2 in the lungs, causing a lower pH value. In people that do not suffer from emphysema, if acidosis begins to occur, their bodies will hyperventilate so that the CO2 is removed from their lungs. Individuals that have emphysema are not able to change their breathing rate, so they are unable to get CO2 out of their lungs. The blood then becomes acidic, and this results in hypoventilation, which is when your breathing rate is unusually slow. When an individual has emphysema, their alveoli are missing the protein elastin from the breakdown of elastase. This causes the alveoli to not hold its shape, causing difficulty exhaling the carbon dioxide. Due to the flattened alveoli sacs, the outside pressure increases, causing more proximal alveoli to be affected. As a result, the airway resistance is increased, which makes it difficult to breathe. Emphysema originates in the base of the lungs, but as it progresses, the whole lung eventually becomes affected. Normally, the lung is protected from proteases, specifically elastase, by alpha-1 antitrypsin, which is an antiprotease. If an individual has a deficiency in this antiprotease, it is a weakened defense against the proteases, causing the breakdown of elastin by elastase to occur more often. This gene deficiency causes the destruction of elastic fibers in the lungs.
Shortness of breath is a symptom that will gradually get worse to the point where it occurs during rest. This is caused because the alveoli are not being able to expand fully, causing you to not be able to fill your lungs with enough air. Lips or fingernails turning blue or gray with exertion is also a symptom. This happens because your body feels like it is not getting enough air, so it will ensure that all your organs receive the necessary oxygen required to function, therefore stealing oxygen from your body's extremities. Another symptom is an individual not mentally being alert. This is because of the brain not receiving the sufficient amount of oxygen, causing the individual's mental capacity to be compromised.
Homeostasis is disrupted due to an imbalance between protease and antiprotease enzyme. Destruction to the alveoli, alveolar walls, and disruption of gas exchange is a result of the imbalance, which further causes acidosis. Cell membrane plays a role in gas exchange due to the damaged alveolar walls. Proteins play a role in emphysema because the protease elastase is breaking down protein elastin, causing a destruction of elastic fibers in the lungs.
Since Bill was an avid smoker for many years, he developed emphysema. He made the decision to quit smoking to slow the progression of his emphysema. Although this disease is not curable, the doctor was able to prescribe Bill an inhaler to help with his difficulty of breathing.